Hello, I'm Dr. Christoforidis. I'm a reproductive gynecologist and the clinical director of Embryolab. I'm going to talk to you about how to choose the right cycle to have IVF treatment. So you're all set for your IVF cycle and you're now waiting for your next period to come. A common question is, how do we choose whether a cycle is good to have IVF treatment? What do we look at? What matters most in the decision to go ahead? Well, before all that, it is important to have completed all tests requested by your doctor and have followed the advice given as to prepare well for your treatment. By now, you'll have had a recent hormone profile done. This is usually AMH, FSH, LH, estradiol and progesterone. And your doctor will have a fairly good idea of your ovarian function. This hormonal profile is repeated on the start of your period, and it does help to decide whether this is a good cycle or not. Choosing the right cycle matters mostly in women with reduced ovarian reserve. This is when the number of eggs that remain in ovaries has gone down, usually as a result of age. A raised estradiol level, usually along with a low FSH level, may signify follicles that have not gone away yet, despite the start of your period. So these need to go away before starting to stimulate the ovaries. Having an ultrasound at this stage will clarify things and give you an accurate diagnosis. Follicular cysts, as they are called, will go away either by simply waiting for your next period or by giving a short course of a contraceptive pill. In case of a raised FSH level, which may go along with a normal or low estradiol level, the number of follicles available for stimulation may be too small. So in this case, you may decide to wait for your next cycle. This is again better judged following an ultrasound of your ovaries. So having an ultrasound in the first 2 to 3 days of your cycle in general does help your doctor to examine the number of small follicles in your ovaries and predict how you respond to stimulation. In case of small follicles having various sizes, some of them being relatively more advanced compared to others, again it may be better to postpone start of your stimulation so as to avoid ending up with follicles of all different sizes, which is not so good in terms of getting good mature eggs at the end of the stimulation. When should you be thinking to postpone treatment in general? Well, when you've recently had better hormonal profile results and better ultrasound findings. Or when you can afford to wait for your next cycle in terms of work or personal commitments. In any case, always discuss with your doctor whether waiting for another cycle does make a difference and what can be done, if possible, to control the cycle by either giving a course of contraceptive pill or a short course of estrogens prior to your next period. Choosing the right cycle for IVF can make a difference in terms of having a positive result. So always discuss with your doctor the data and explore your options carefully.